Hello people. So, in this video, I want to talk about the diagnostic and the treatment of urinary tract infections. So when it comes to diagnosing these infections, we can look at this pyramid. So at the bottom of the pyramid, we have the basic tests any doctor and any little hospital and clinic can do. As we move further up, we get to tests that only specialized personnel can do, and these tests cost more money. So these baseline tests are cost effective, so they don't cost much. But as we move up, the tests are higher in price, and also special doctors that are specially trained need to do them or analyze them. So obviously in any disease, so is it also with urinary tract infections, the basic two elements in any disease, so this is the same in urinary tract infections, the basic two elements are the history taking, so the anamnesis, and the physical examination. So these are the two basic elements we start from. And if we ask our patients about the symptoms and he complains about dysuria, frequency of urine, we obviously ask around if there are other problems, for example, at the GI tract, and if the patient only concentrates on the urinary system, we then proceed to a physical examination, examining if there is flank pain, if there is fever, if the patient has abdominal pain, suprapubic pain, and if these methods are suggesting that we have a urinary tract infection, and if we think that we need to do a urinalysis, this is the second step. So a second step is to prove a urinary tract infection with a test would be to do a urine analysis. And this is really a baseline laboratory test everyone can do and analyze. If we need other tests, we probably can also do on this level complete blood count and CRP or C-reactive protein to differentiate between other diseases that can have a similar clinical presentation. So sometimes cystitis can look like appendicitis. So you would need to do a more thorough anamnesis and physical examination, and also do a CBC and CRP. But if these tests conclude that we have a urinary tract infection, most of the time these tests are enough to diagnose a UTI. So on primary medical level, these tests are enough to diagnose a UTI. Sometimes physicians are also trained in doing an ultrasound, which is a great method to see how all the organs are looking, if there are some kidney stones. So these tests basically can be done on a primary medical level. Now, the patient sometimes has a more complicated infections. And if we need to do a more thorough structural examination of the UTI, we would do a CT scan, so a computer tomography or a MRI, magnet resonance imaging, and these need to be analyzed by a radiologist. So then after all these methods, there are specialized methods the urologist does, and this is looking, for example, with the camera into the bladder. This is called cystoscopy. So these methods are done in other secondary medical institutions. But as I said, history taking, physical examination, and urinalysis in most of the simple, acute, uncomplicated urinary tract infections, which are the most of the patients have these, they can be solved on primary level. Obviously, complicated infections need more tests and personnel that is trained in treating these complicated infections. So I already explained history taking and physical examination. So now we will look at this urinalysis. Complete blood count, basically we would look if what white blood cells are elevated, and CRP, if it is elevated, we have inflammation. Now we will look at urine analysis because it is a key test to analyze obviously the urinary tract and especially the urinary infections. So in urinalysis, a sample of urine is taken, and the urine is taken into special little boxes. They don't look like this, and it needs to be analyzed in a few hours. So in 2 hours of taking, it needs to be analyzed. If it is not analyzed in this time, it needs to be put in a fridge. So urinalysis is, as I said, a baseline laboratory test. Urine. And urinalysis consists of a physical examination of the urine, of chemical examination of urine, and the microscopic examination of your urine sediment. So the urine sediment is a part of urinalysis. The first element that is looked at is obviously the physical. So the physical characteristics of the urine. And for example, we can look at the color. The color of our urine is normally all kinds of shades of yellow. So basically it has a yellow color. The urine, if it is diluted, it will be not that dark. It will look basically like water if it is highly diluted. But if it is concentrated, it will be darker colors of yellow. The second physical characteristic is clarity. And basically, our urine needs to be clear. It can maybe be a little bit cloudy, but not too much. So out of these physical characteristics, you can actually not tell that much. Now we come to the important one, I would say, is the chemical characteristics of the urine that are analyzed in urinalysis. So first of all, we have the specific gravity of urine. The specific gravity of urine is a normal value is 1.5 to 1.35. So this is the normal possibilities of values are in between these two values of urine specific gravity. If it is going to the lower number, it means that the urine is diluting, and if it is going to this number, it is concentrating. Then we have also the pH of urine that is analyzed, and urine is normally slightly acidic, but it can range in pH from 4.5 to 8. Also, we can analyze some specific molecules in the urine. For example, proteins. This is very important. So we can analyze if there are proteins in the urine. Normally, we have no proteins in the urine, or a very small amount. Someone who is doing more physical activity or someone who has fever will have some proteins in the urine, but basically they are not present in the urine. Glucose, also very important. So glucose is not present in the urine normally. Only if we have a high amount of, in diabetes, high amount of blood sugar or high amount of glucose in our blood, we can have glucose urea. So glucose in the urine. Normally, it is not present. Also, ketones are normally not present in the urine. So later in diabetes, we can have also many of these products in the blood, and then they can be also secreted in the urine. Secondly, bilirubin is also analyzed in the urine, and it is also not present. So the urine should be negative on this molecule. Then we have a product called nitrate. Normally it is not present. In our urine, we have this product called nitrate. So this one is present. And it is normal that we have this molecule present in our urine. So this is present in our urine. But there are some bacteria, especially enterobacteria. So enterobacteria, like E. coli, these enterobacteria have the possibility to convert this product that is normally present in our urine into this product. And then our urine, when it becomes positive on nitrate, we can assume that we have a bacterial infection with a bacteria that can convert this product into nitrate. So, but if we have a negative nitrate, it doesn't mean we have no infection, because there are other bacteria that don't convert, that don't make this reaction happen. So some bacteria do convert this product into this product. The last molecule is actually a product of leukocytes, and it is called leukocyte esterase. So leukocyte esterase. This product is normally present, but it is not present in a high amount, and it will not be detected. But if we have infection, the leukocytes are producing it, and the leukocytes are being destroyed in the process in fighting of the infection, and this will become positive. And when it is positive, we can assume that we have an infection and that our immune system is fighting off an infection. Now, I would proteins are commonly present in every urinalysis. Almost in every laboratory they are done. Also, some laboratories commonly do in this test of if the nitrate is positive, and glucose if it is positive, if we think that there is a urinary tract infection. And then there is the urinary sediment. So the urine sediment, the sediment analysis. So this would be a microscopical analysis of our urine. First, we can analyze if there are red blood cells in our urine. Normally there are a few, and from 0 to 5 red blood cells is normal. So this would be a normal amount, and this would be physiological. But if there is more than 5, we can assume that we have some kind of problem. And if we find red blood cells in the urine, this is commonly regarded to be a sign of presence of stones in our urine. So if you see red blood cells in the urine, you can assume that there probably is somewhere a stone in the urine. It also, if you see many red blood cells, you can assume that maybe the patient has some kind of malignancy, especially if it is an older patient. The second thing that is analyzed are white blood cells. So this is also very important, leukocytes. Normally, 0 to 5 leukocytes are present. So 0 to 5. If there are more, we can assume that we deal with an urinary tract infection. Then we can also find epithelial cells in our urinary tract. It is normal to find a few cells. If we find more of these cells, we can assume that something pathological is happening in the urinary tract. Then also we can see bacteria. It is normal that the urinary tract is sterile. So the urinary tract is sterile. That is the normal situation. If we see bacteria, then that can mean either that the patient has contaminated the urine when he was taking the urine, or that we have infection. So contamination or urinary tract infection. And the last thing we could see are casts. So casts are formations of different products that resemble the shape of the tubes of the nephrons. So basically, it is normal to have a few casts that have some proteins in them, and these casts are called hyaline casts. It is normal to have a few of these casts in the urine, so from 0 to 5. If we have more, we can assume that something pathological is happening. And basically, in urinary tract infection tests, many laboratories will give you the amount of white blood cells in the urine and the bacteria in the urine. So, if we would now take all of these informations that we gathered so far and look what on a few cases and how we would treat these cases. So for example, if we have a case where a patient has done a routine checkup and has done a urine test, a urinalysis, and we have in his urinalysis proteins that are negative, leukocytes that are also negative, but we see that there are many bacteria. So when they are describing bacteria, they say that, for example, there are many, there are a few, and so on. So if they say there are many bacteria, but if we have negative proteins and no leukocytes, this basically means that the patient managed to contaminate his urine. So this is basically only a contamination and does not need therapy. So the urine wasn't taken correctly. So the patient does not have an infection. The second possibility is something called asymptomatic bacteriuria. So asymptomatic bacteriuria means that our patient, has gone to a routine medical checkup. He has no symptoms, but he taken his urine correctly, but the urinalysis is telling us that the patient is basically having, for example, negative proteins, more than 5 leukocytes, and many bacteria. So, but the patient is a young patient, he is not in the risk group, and he has no symptoms. So, in this case, where the patient has no symptoms and he is not in a risk group, so has no comorbidities, this that is not treated. It is only checked from time to time, but no therapy. So these are the instances where we would do no therapy and that we would not treat. Now we come to the common one, the infection of the urethra and the bladder, urethritis or cystitis, that give basically the same or a very similar clinical presentation. So the treatment of cystitis. Cystitis is and urethritis is basically accompanied with a symptom that is dysuria. You can also have frequency in urinating, suprapubic pain, but you will have no fever and no other significant problems. It is mostly caused by Escherichia coli or E. coli, and it is mostly happening in women because of these anatomical predispositions in their body. And it is also, if it is happening in young patients, in patients that are in their reproductive years, and that have no comorbidities, it is actually an acute, uncomplicated infection. These infections, if you do a urinalysis, the patients will have positive proteins. They have raised leukocytes in their urine, and there are many bacteria in the urine. So basically, this is what we have, what is shown in the urinalysis. Also, if you have positive proteins and if you have elevated leukocytes, but if you have low bacteria, this is also, so the leukocytes and the positive proteins tell you that an inflammation is happening, no matter that the bacteria are low. So this is what you would see on a urinalysis or in a urine sediment. How is this treated? First of all, you need to tell the patient to drink a lot of water and fluids, so to wash out the bacteria, and this is very helpful. The second thing are obviously antibiotics. So antibiotics that are used in these infections, some of them. So trimethoprim, sulfamethoxazole, that is most commonly 480 milligrams, is used two tablets on 12 hours for 7 days. So this is an effective treatment. It is hard on the stomach, I need to say. So it is hard on the stomach. So you need to drink this tablet after you eat something. Then another possibility, there are many effective therapies today. So another possibility is nitrofurantoin. So this medicine is given 50 milligrams 4 times 1 tablet, 7 days. Then, of course, we have cephalexin, also very commonly given. 500 milligrams are given 2 tablets in 12 hours for 7 days. Then another possibility would be ciprofloxacin. Ciprofloxacin. Also 500 milligrams, 2 times 1 tablet in 7 days. So all of these treatments have proven themselves in the therapy of cystitis. Now, the last and the more serious infection that not everybody can treat and that needs to be looked at by a specialist, by a urologist, is pyelonephritis. Pyelonephritis is, in simple terms, an infection of the kidney. So in this disease, we would need to do a complete blood count and also C-reactive protein. And these patients would present with high fever, with flank pain. The urine, they would have positive proteins, they would have many leukocytes, also they would have many bacteria in the urine, and also positive casts. So these patients, if the patient does not have comorbidities, so if it is an acute, uncomplicated pyelonephritis, it basically can be treated with oral antibiotics. Maybe an initial dose of intravenous antibiotics can be administered, but it can also be treated perorally. For example, you could start the patient with intravenous antibiotics. So you could give a patient an initial dose of 1 gram IV dose of ceftriaxone antibiotic, which is a strong antibiotic. You could give the patient only 1 intravenous dose of the antibiotic and then continue per oral treatment, for example, with amoxicillin clavulonic acid. Amoxicillin clavulonate. Or tablets have 1 gram in them. They're given 2 times a day, 1 tablet for 10 to 14 days. There are also other possibilities like ciprofloxacin, trimethoprim sulfamethoxazole that are given for an extended period from 10 to 14 days. But if you have a severe case, the severe cases, so a severe case is treated with intravenous application of antibiotics in a clinical setting. So the patient is hospitalized and monitored. And in some severe cases, very high profile antibiotics are given, like meropenem. And mostly if the patient needs these kinds of antibiotics, some kind of antibiotic is given, but it is only given until we get the test of a urine culture. So a urine culture analyzes which bacteria is present in the urinary tract, and it also comes with an antibiogram. And the antibiogram shows on which antibiotic the bacteria is susceptible. And then we would switch from this first initial therapy to this specific secondary therapy that is more specific and targets the pathogen better. So this would be a basic analysis of the treatment and the basic look at the diagnostics of urinary tract infections. Basically, the take-home message is that in the primary setting, any doctor can treat a simple cystitis, a simple infection of the urethra and the bladder. But if the infection is more complicated, like pyelonephritis, these patients need to be seen by specialized personnel that analyze these infections more often, because pyelonephritis has the possibility of spreading further, so going over into the blood and causing sepsis. And then this is a huge problem, especially in elderly people, in people with some comorbidities. This would be a significant disease that could cost the patient his life. So this is the basic overview of treatment and diagnostic of urinary tract infections. Thank you.